So today we're going to talk about catheter care and catheter maintenance if your horse is having an IV catheter in the field that you are going to have to take care of. So points of reference, this is the catheter right here. It's going into the jugular vein of this horse's neck. This is the extension set. And this is the injection port where we're going to inject medications. This horse has his catheter unwrapped right now so we can see all the different points. In the field, many times we would have a wrap over this to protect it so the horse doesn't rub it out. So one of the things you're going to have to do with the catheter is administer medication through the catheter. Medication and our flush. We're going to find our injection port. The first thing we need to do is we need to flush the line and verify that it is still a usable line. So here's our injection port here, and there's a rubber stopper at the end. We're going to take our needle, slide it through the center of the rubber stopper. We have to open the stopcock here to allow the fluids to run to the catheter or to come back through. We want to pull back and make sure that we're in, and we're not in. Oh, there it is. It was clotted, and that could happen. So you want to pull back and then flush through. So in that case, that horse had a clot in the line, which can happen when these catheters have been in for a little bit. Then we're going to take the needle out of the injection port, close your stopcock again so blood can't come back up the line, insert your medication syringe into the rubber stopper, undo the stopcock, inject your medication. Now this medication is in the line and is not in the catheter, so we need to follow that with a flush. Make sure you don't poke yourself as you take these needles in and out. Then you're going to repeat the flush on this side. You want to try to get the needle into the line as far as you can to deposit the medication in the line and not in your injection port. Then you're going to flush through again. Minimum of 10 mLs should be flushed through the line, or 10 cc's, and then close your stopcock once again and remove your catheter, or remove your needle from the catheter. And then put this back in the safe place underneath the wrap. This also needs to be done, the flushing needs to be done every 6 hours while the horse has an IV line in, even if things aren't being ran through the line. Another thing that might be ran through this line, if it is IV fluids. So we'll talk about how to hook a horse up to the catheter with the IV fluids. This is a common setup that we use in the field to run fluids into the horse, so we can run 2 bags at a time. The spikes go in the bottom of these fluid bags here, so you would remove these little green, these have a green screw on cap that we would remove, and they would push the spike up through the line, and the fluids would start running through this chamber down into the line. And you do the same thing on the other bag. Once you have ran fluid through the entire line and have all the air out of your line, you would go ahead and you would close all of these clamps. And this fluid line would normally be hung above the horse's head to allow the fluids to go in the horse using gravity. So you just go down and you want to make sure everything is closed. And then we're going to hook them on to the horse. To do that, we need to remove the injection port. You don't want to lose that. It's very important. So make sure everything's off, including this valve to this horse. You're going to remove, this has a needle to keep the end sterile. Remove the needle from that end, from your fluid line, and then remove your injection port from here. You want to put your injection port on your needle and then put it in a safe place. Then you're going to take your end of your line and screw it onto the end of your fluids. Then you need to go through and start opening up all of your chambers. So you would open up this one. You would open these up. This just rolls down. Actually, this one rolls up, I lied. That pops open. And these would open up. In that case, the fluid would start running into the horse. These are empty, so there's no fluid running in. When you are done running fluids, or you need to change out a bag, you need to go through and reclamp everything again. There's a lot of clamping involved with this. and clamp the one to the horse as well. And then we would change out our fluid lines. We would drop the bags down. We'd pull these spikes out. And then you would put the new bag on and push the spike back into the bag. Then repeat, go through, open everything up, and restart your fluids back into the horse. When it's time to detach the fluids and stop running them, either because you're going to give the horse a break or you're done with the treatment, we need to go through and do everything reverse. You want to make sure that you don't contaminate either your catheter line or your fluid line. So again, you're going to unscrew, and they can be a little bit persnickety at times. Unscrew your fluid line from your extension set. Replace your injection port. Replace the needle on the end of your line. And then you need to flush the line again. When in doubt, flush the line. Common things that can go wrong, why things aren't flowing through, are that you have kinks that have developed across the line. So either a kink that's developed right here that's preventing the fluids from going through, or a kink that's developed in your line, or you forgot to open one of your valves. So go through and double check that. Another thing that can happen is this part right here can sometimes become detached, and then either you'll run your fluids in and they'll just run right down the horse's neck, or it'll cause this catheter to clot and no longer be patent. If it's having a hard time flowing through, try to flush your flush through really aggressively and try to see if that'll knock a clot off the end of the catheter. They will clot these off over time. If you notice that the horse has any swelling or pain at the site of the catheter, you need to notify the veterinarian right away. It can be a sign that the catheter is getting infected.